Hello, welcome to the video. Please watch the video completely. In this video, I will discuss the causes, symptoms, diagnosis, treatment and prevention of typhoid. Typhoid fever. It is disease caused by the infection of bacterium called Salmonella typhi. What causes typhoid fever? The bacterium Salmonella typhi, S. Typhi, causes typhoid fever. The bacteria spreads through contaminated food, drink, or water. People infected with Salmonella typhi carry the bacteria in their intestinal tract and blood. Salmonella typhi is shed, discarded from the body in feces, stool. You may get typhoid fever if you ingest food or beverages prepared by someone who is shedding the bacteria and who does not wash their hands properly. In less developed countries, sewage containing Salmonella typhi may contaminate local water supplies. What are the symptoms of typhoid fever? In early stages of the disease, symptoms include abdominal pain, fever, and a general feeling of being unwell. These initial symptoms are similar to other illnesses. Symptoms often include high fever of up to 104 degrees Fahrenheit, headaches, abdominal pain, constipation, then perhaps diarrhea later, small, red spots on your abdomen or chest, rose-colored spots, loss of appetite and weakness. Other symptoms of typhoid fever include body aches, bloody stools, chills, severe fatigue, difficulty paying attention, agitation, confusion, and hallucinations, seeing or hearing things that are not real. Diagnosis and tests. How is typhoid fever diagnosed? Doctors use a simple blood or stool test to diagnose typhoid fever. This test identifies the presence of Salmonella typhi in blood or stool samples. How is typhoid fever treated? Antibiotics are used to treat typhoid fever. These medications kill the bacteria that cause the infection. Several different types of antibiotics are used to treat typhoid fever. In many cases, typhoid fever is treated with ampicillin, chloramphenicol, or cotrimoxazole and azithromycin. Some people need supportive therapies, such as fluid or electrolyte replacement, depending on the severity of the infection. What complications are associated with typhoid fever? People who do not receive treatment for typhoid fever may have symptoms of the disease for months. In those cases, complications like kidney failure or intestinal hemorrhage, severe bleeding, are possible. In severe cases, typhoid fever is fatal if left untreated. They may also become carriers and spread the illness to others. Prevention. Can typhoid fever be prevented? Receiving a typhoid fever vaccination. Currently, 2 vaccines are available to help prevent the spread of typhoid fever. Avoiding food that is raw or undercooked. Drinking only bottled water or water that has been boiled. Thoroughly washing your hands each time before eating. Avoiding raw fruits and vegetables that cannot be peeled. Avoiding eating foods and beverages purchased from street vendors. Thanks for watching.